Tell us when you're ready, please. Are you folks ready?
Chad, we'll take it up on the screen.
Everybody ready? Okay, Chad, do you want to start it? Do you want to start off?
Well, Mr. President, Vice President, thank you for being here. Really appreciate your visit to FEMA. I think your visit really, as you indicated last week, by signing the national emergency, has really empowered FEMA. We've gone to a level 1 here at the NRCC and continue to support the emergency, continue to support all elements, and really working with the interagency and our state and local partners. The governors, who you'll talk to here in a few minutes, know the FEMA process, know how that works in cases of both natural and man-made emergencies. And that's the process that we'll be using going forward, making sure that they are linked up with their emergency operations centers and tied into FEMA. So again, thank you for being here. We look forward to your remarks. So thank you.
Well, thank you very much. And it's great having FEMA involved. We've had tremendous success working together, and we appreciate all of the people here. And it's an honor to be with all of you. You're doing a fantastic job, by the way. And so now we're, as of yesterday, when we gave the order, FEMA is totally involved in addition to everybody else. And a lot of progress is being made, so I look forward to speaking to the governors. And from what I understand, we have pretty close to 50 of the governors and some territories on, and we have a lot of, just about everybody showed up, so that's very nice. And we will put them on the screen as soon as you want. Thank you. Thank you very much. Mike, you want to say something?
Thank you, Mr. President. Thank you, Mr. President. And I want to add our thanks not only to the great team here at the National Response Coordination Center and FEMA, as FEMA takes the lead in implementing the policies that you approve from the White House Coronavirus Task Force, but as you do continually, Mr. President, I want to thank all the governors that are joining us today. Today is an opportunity to talk about the progress that we are making on mitigation, on testing, on supplies. We understand as FEMA's mission that this effort through FEMA will be locally executed, state managed, and federally supported. And I want all the governors to know that we are with you every step of the way. We are absolutely determined at the President's direction to make sure that you have the resources and the support as you see to the health and well-being of your communities. We commend the governors. At this point, Mr. President, as we told the country today, 3 states are 50% of the coronavirus cases in America today. So we're focusing resources at the point of the need. The governors in those states, their state health officials are responding with great professionalism and great speed. We'll continue to support those that are directly impacted. But by standing up through your national emergency declaration, Mr. President, standing up FEMA and standing up the National Response Coordination Center, we want our governors, we want all of our state and local health officials to know that we are, as you say, bringing the full weight of the federal government to bear to support our states and our local communities, and that we'll get through this coronavirus and we'll get through this together.
I agree with that 100%. Thank you very much. And for the media, I guess perhaps you're going to stand aside. We're going to have the screen right behind you, and we'll start opening this up to the governors. If that's okay, please. Yeah, go ahead.
One question for you.
Thank you very much. I would like to begin by announcing some important developments in our war against the Chinese virus. We'll be invoking the Defense Production Act just in case we need it. In other words, I think you all know what it is, and it can do a lot of good things if we need it, and we will have it all completed, signing it in just a little while, right after I'm finished with this conference. I'll be signing it. It's prepared to go. So we will be invoking the Defense Production Act. Last week I signed an emergency declaration under the Stafford Act, which, as you know, we invoked previously, and which activated FEMA's National Response Coordination Center. FEMA now is fully engaged at the highest levels. Today, FEMA is activated in every region. We are at level one being the highest level, which we will work with, and we've been working with FEMA. I've done a lot of work with FEMA. They're incredible. It's always been on hurricanes or tornadoes. They're right now in Tennessee, a large group working in Tennessee have been incredible. That was a tragic event. Alabama last year, also a tornado, and then obviously the numerous hurricanes in different locations that were, in some cases, very devastating, and in every case, FEMA came through. This is a very different kind of a work for FEMA, but they will come through, as they always do. We have tremendous people, tremendous talent in FEMA. We're sending, upon request, the 2 hospital ships. They're being prepared right now. They're massive ships. They're the big white ships with the Red Cross on the sides. One is called the Mercy and the other is called the Comfort, and they are in tip-top shape. They soon will be. They're getting ready to come up to New York. I spoke with Governor Cuomo about it. He's excited about it. And I also, we haven't made the final determination as to where it's going to go on the West Coast. The Comfort is located now in San Diego, and it's going to be, we'll be picking the destination fairly shortly. So those 2 ships are being prepared to go, and they can be launched over the next week or so, depending on need. Earlier this week, the first clinical trial of the vaccine candidate for the virus began in Washington State, as you probably know. The genetic sequence of the virus was first published in January, but thanks to the unprecedented partnership between the FDA, NIH, and the private sector, we've reached human trials for the vaccine just 8 weeks later. That's a record by many, many months. It used to take years to do this, and now we did it just in a very short while. That's the fastest development in history of what we're doing with regard to the vaccine. We're making very, very big progress. Today, I can announce further steps to expand testing capacity. We're working with several groups to determine if the self-swab, a much easier process than the current process that's not very nice to do, I can tell you, because I did it. But we have a current process that's a little bit difficult. If you have it done, the groups are working on determining if a self-swab by an individual is as effective as the other. The other is very effective, very accurate. But we're going to see if we can do a self-swab, which is would be a lot more popular, I can tell you that. So, and that would be administered also by a health official, but it would be a lot easier to do. The fact is that the health professionals would free up a lot. Let me just say, the self-swab is what it is. It's a self-swab. You do it yourself. The other has to be issued by a health professional, and it's something that is quite difficult. And we think it's working out for the self-swab. And if it would test positive, the people would go and they would do what they have to do. But we think that's probably working out. I've asked the FDA to cut through the red tape and reduce regulatory barriers. We are looking at some very exciting things, and I'm going to be holding a second news conference either today. We're going to talk about the FDA. Some things are happening that are quite exciting. And We're going to be doing that either later today or tomorrow, fairly early tomorrow. So we'll see what happens. But the FDA, at my instructions, I've been working very, very hard on a number of developments, and we'll be discussing them with you later today or tomorrow. And this afternoon, I'll be meeting with nurses on the front lines of the battle against the virus. They're truly American heroes. They want to get it done. They're incredible people. So we're going to be meeting with nurses, and I actually look forward to that. They're very brave. They're taking a lot of risk, and they have done an incredible job, and they never complain. Today, I'm also announcing that the Department of Housing and Urban Development is providing immediate relief to renters and homeowners by suspending all foreclosures and evictions until the end of April. So we're working very closely with Dr. Ben Carson and everybody from HUD. Every generation of Americans has been called to make shared sacrifices for the good of the nation. In World War II, young people in their teenage years volunteered to fight. They wanted to fight so badly because they love our country. Workers refused to go home and slept on factory floors to keep assembly lines running. And, you know, the numbers of ships that they built during World War II to this day nothing like that has ever been equaled. They were doing ships literally on a daily basis. Nobody's ever seen anything like it. And to this day, nobody's seen anything like that, what they were able to do during World War II. And now it's our time. We must sacrifice together because we are all in this together, and we'll come through together. It's the invisible enemy. That's always the toughest enemy, the invisible enemy, but we're going to defeat the invisible enemy. I think we're going to do it even faster than we thought, and it will be a complete victory. It'll be a total victory. So we'll have a second conference, again, having to do with the FDA and this. I think it's going to be potentially a very exciting news conference, and we will do it as quickly as we can, so whether it's today or tomorrow. And I'll, with that, ask Mike Pence to say a few words, and thank you very much.
Thank you, Mr. President. The White House Coronavirus Task Force met this morning, and now that we have cases in all 50 states, we're continuing to move out on the President's call to bring the full resources of the federal government, a full partnership with every state and territory, the full power of the American economy to support businesses and families. As the President says to us and every day, we'll do whatever it takes. We're all in this together. Yesterday, the President met with the tourism industry executives and also had an engaging discussion with all the top companies in our industrial and medical supply chain. The President, as you all are aware, also announced today that by mutual consent, the northern border to Canada will be closed to non-essential travel. This does not include essential travel or the transit of goods, but it was through mutual discussion that took place this morning between the President and Prime Minister Trudeau, and the Department of Homeland Security will be effectuating that decision. The President spoke with some of the nation's top business leaders today, again, to speak about the supply chain in the country. For our part, we're going to be conducting a conference call later today with state and local health officials to renew our ongoing commitment of cooperation and collaboration. As the President said last week in signing the Stafford Act, he stood up the National Response Coordination Center, and today at the President's direction, FEMA has gone to level 1. FEMA's mission is to support disasters that are locally executed, state managed, and federally supported. And tomorrow, the President will be hosting all the nation's governors from a video conference at FEMA to ensure that they have a full connection to all of the activated regions for FEMA going forward. With regard to testing, I'm pleased to report that we're increasing the number of tests being performed by the thousands every day, thanks to the public-private partnership that President Trump forged with commercial laboratories around the country. Our health experts tell us to remind every American, it's important to remember, people without symptoms should not get tested. We want to make sure that the supply of testing is there for those that need it most or are symptomatic or in the vulnerable population. Dr. Deborah Birx in a moment will address the progress that we're making on testing, the infection rate, our recommendations to every America, as well as some important new findings about the impact on youth that we're gaining from data that's coming in from Europe that'll be important to every American. On the subject of supplies, the President has our task force extremely focused, as the President mentioned mentioned that he's invoking the Defense Production Act today. Secretary Esper in a few moments will describe the ongoing efforts that the Department of Defense is taking to make medical resources available. Secretary Robert Wilkie will announce decisions the VA has made to expand hospital capacity within their system. Also, with regard to medical personnel, at the President's direction, HHS is issuing a regulation today that will allow all doctors and medical professionals to practice across state lines to meet the needs of hospitals that may arise in adjoining areas. In addition to that, we are again today asking every American and our medical community leaders and hospitals to partner with us in delaying elective procedures across the country in our healthcare system to ensure that medical supplies and medical capacity go where they're needed most. Seema Verma will describe guidance that CMS will be issuing on that front. And finally, I want to remind every American of the President's 15-day guidance to slow the spread. We are grateful for members of the media and the general public that are adhering to these, sharing them with neighbors and friends. All of our experts continue to believe that if every American will do their part and embrace and put into practice these principles, that we can significantly limit the reach of the coronavirus in the weeks and months ahead. Thank you, Mr. President.
Thank you very much. Dr. Birx, please.
Thank you. Thank you, Mr. President, Mr. Vice President. So, we continue to look at data every single day. There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs. We think part of this may be that people heeded the early data coming out of China and coming out of South Korea that the elderly or those with pre-existing medical conditions were at particular risk. It may have been that the millennial generation, our largest generation, our future generation that will carry us through for the next multiple decades, there may be disproportional number of infections among that group. And so even if it's a rare occurrence, it may be seen more frequently in that group and be evident now. So we're looking at that information very carefully. We have not seen any significant mortality in the children, but we are concerned about the early reports coming out of Italy and France. So again, I'm going to call on that generation that's part of that group that brought us innovation, particularly throughout all of their ability to look around corners and skip through games. I always went level by level. I didn't realize that you could go from level 3 to level 7. That's what they've taught us. They look for things that we don't see. We need them to be healthy. So again, not only calling on you to heed what's in the guidance, but to really ensure that each and every one of you are protecting each other. And so we cannot have these large gatherings that continue to occur throughout the country for people who are off work to then be socializing in large groups and spreading the virus. You have the potential then to spread it to someone who does have a condition that none of us knew about and cause them to have a disastrous outcome. Finally, on the testing piece and what we're learning, I know last week in bringing the private sector, I think what has been exciting to me over the last 2.5 weeks is to see this administration harness the full capacity of the private sector, understanding that a lot of our solutions that we need to confront this virus rely on the private sector. Bringing the private sector commercial labs was critical into this process. We are now beginning to see that they have spread out in a prioritized way because we asked them to prioritize the regions that were mostly affected. And so you still may have difficulty getting tests in areas that do not have significant cases. We've had them prioritize the regions where we need diagnosis and their diagnostic percent. Remember I told you South Korea was under 4%, so 96% of people were negative. The last report we've seen from the laboratories have about a 7+% positivity rate. Still 93+% or 92% are negative. But I think that's encouraging to me personally that we're prioritizing appropriately to those areas that have the greatest need. Today and yesterday, Thermo Fisher pushed out most of their laboratory testing capacity, and that will dramatically increase that platform and the ability to run additional tests in addition to Roche. So I appreciate everybody's attention to these numbers. I'm excited that we've prioritized where the need was the greatest. But again, please follow the guidance and please make sure in every report that you're putting out that you're talking about the presidential guidance to actually stop the spread of this virus. Thank you.
Thank you, Deborah, very much. Mark, please.
Sure. Thank you, Mr. President.
So good afternoon, everyone, and I want to provide an update on DoD's coronavirus efforts as we continue to focus on our three priorities. That's, first of all, protecting our personnel and their families. Second, safeguarding our national security mission capabilities. And third, of course, supporting the administration's whole-of-government approach. First of all, though, I do want to assure the American people that the United States military remains ready and capable of defending the country and our interests abroad. Now, with that, the Department is leaning forward in our response to COVID-19. We have issued international and domestic travel restrictions to all DoD personnel and families that should dramatically reduce potential exposure to the virus. Those have been in place for some time now. As I announced yesterday, the Department of Defense will make available up to 5 million N95 respirator masks and other personal protective equipment from our own strategic reserves to the Department of Health and Human Services for distribution. The first 1 million masks will be available immediately. We are also prepared to distribute to HHS up to 2,000 operational deployable ventilators for use as needed. Yesterday, I was at Fort Detrick, Maryland, which is probably the military's premier research institute, where I got updated on the incredible work our people are doing as part of the interagency team to work on vaccines and therapeutics. They are making great progress there. We also have announced that we've certified our 16th lab, or will soon certify our 16th lab to help with processing tests from across the country. Additionally, I have directed, as the President mentioned, that the hospital ships Mercy and Comfort be prepared to deploy to increase the nation's medical capacity. And we have also alerted a variety of field and expeditionary hospitals to be prepared to deploy as well as needed, based on direction from the Commander-in-Chief. Today, leadership from the Army Corps of Engineers is in New York, meeting with Governor Cuomo and his team. I spoke with Governor Cuomo yesterday, and other governors I will be speaking to more in the coming days to make sure that they know what DoD can provide through our system to address their needs. In my conversations with governors and members of Congress about DoD's resources, I've made it clear that we will continue to support the administration's comprehensive efforts and the country every step of the way while ensuring our nation's security remains the top priority. I want to conclude by thanking again all of our service members and their families who have been affected by this outbreak. They are all great heroes. We are continuing to support them throughout this. We are all in this together. Thank you all very much.
Thank you very much, Mark.
Thank you. So yesterday, the President made a very important announcement about telehealth, and this is allowing our 62 million seniors to be able to get some medical services from the safety of their home, reducing their risk and without any copays. But we're also making sure that the healthcare system is prepared and that those on the front lines have the support that they need. The reality is the stakes are high, and we need to preserve personal protective equipment for those that are on the front lines of this fight. And to that end, we have put out guidelines over the last 2 weeks to expand the types of masks that can be used in routine care and saving those N95s for the most risky situations. Conserving personal protective equipment is also essential to combat the virus. So today, CMS will announce detailed recommendations to further promote this needed conservation, specifically by limiting non-essential elective medical and surgical procedures, including dental procedures. We believe that these recommendations will help surgeons, patients, and hospitals prioritize what is essential while leaving the ultimate decision in the hands of state and local health officials and those clinicians who have direct responsibility to their patients. And we urge providers and clinicians and patients to seriously consider these recommendations. They will not only preserve equipment, but it also allows doctors and nurses to help those that are on the front lines. And it'll protect patients from unnecessary exposure to the virus. We fully appreciate that this is going to have a major impact on the healthcare system, but the shared sacrifice is essential to help those that are on the front lines. And I want to thank the medical societies such as the American College of Surgeons and the American Dental Association that took a proactive approach and already posted these recommendations. And we've also talked to the American Medical Association, and they have fully indicated their support for this recommendation. We now invite the entire healthcare community to join us in this effort. Thank you.
Thank you very much. Robert, please.
Thank you, Mr. President. My instructions from the President were very clear. I was to do everything imaginable as aggressively as possible to protect the 9.5 million veterans who are part of the Department of Veterans Affairs. Last month, we established 19 emergency operations centers across the country. We began to limit the number of visitors who entered our facilities. We began, I think, we were the first system to begin triaging across the country in our 170 hospitals the entrance of anyone into our facility without being questioned or tested. We expanded those restrictions to those in our 135 community living centers, which have about 7,800 veterans who are in acute conditions, to make sure that they were protected. We also took the next step and made sure that we limited the dental surgeries that we were provided. We've cut back by 1/3 the number of routine appointments we have had, and we have canceled elective surgeries. These were all part of the President's directive to be as aggressive in a public health sense as we could be. And I think we have set the pace for the entire country. I will say, we've often said that we work the most noble mission in the federal government. Our veterans have been in the toughest spots in the world. They have been put in conditions that are unimaginable to most Americans, and they have responded. They have responded clearly. They have responded with passion, and also the 400,000 members of our department who are out there on the front lines. The last thing I will say is that you've heard a lot about the fourth mission that VA has. Our first three missions are health care, benefits, and memorial affairs. Our fourth mission is to support the federal government in times of natural disasters and pandemics. We are the buttress force in case that FEMA or HHS calls upon us to deploy medical professionals across the country to meet crises. We plan for that every day. We are gaming out emergency preparedness scenarios, and we stand ready when the President needs us to expand our mission. Thank you.
Thank you very much, Robert. Thank you. Thank you all. That's very nice. Any questions, please?
Thank you. Two questions, if I may. Your Treasury Secretary was on Capitol Hill talking about the potential for what could come, and he said that unemployment could skyrocket to 20%. Are we looking, that could rival the Great Depression? Are we looking at potentially historic
No, well, I don't agree
devastation?
with that. Yeah, no, I don't agree. That's a absolute total worst case scenario. But no, we don't look at that at all.
Thank you. And my second question.
We're nowhere near it.
Okay, why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China. That's why. Comes from China. I want to be accurate. Yeah, please, John, please.
The aides behind you. Are you comfortable with this term?
I have great love for all of the people from our country, but as you know, China tried to say at one point, maybe they stopped now, that it was caused by American soldiers. That can't happen. It's not going to happen. Not as long as I'm president. It comes from China. John, please.
Two questions, if I could, Mr. President. First of all, on the Defense Procurement Act, you're invoking it today. Senator Schumer
Yes.
said
on the floor a short time ago that it urgently needs to be put into action to produce medical supplies, particularly ventilators.
Yeah.
Do you have some targets that you would like to see immediately spooled up under the
We
act?
do have. We have tremendous numbers of ventilators, but there's never been an instance like this where no matter what you have, it's not enough. That would be the case. And we will be, it's being signed. It's essentially drawn, and I'm going to sign it in just a little while. If we need to use it, we'll be using it at full speed ahead.
Sorry, he says it's urgently needed to be used. Do you have some
Well,
targets?
we're going to know whether or not urgent, but we will, yeah, we do have targets. We have targets for certain pieces of equipment. We have targets for masks. You know, the masks, the numbers of masks are incredible. We've ordered millions of them, but we need millions more. A thing like this has never been requested, and we've never had to even think in terms of these numbers, but we need millions of masks, and all of that will be ordered. We need respirators. We need ventilators is a big thing because it's a complex piece of equipment. So we have a lot of ventilators, but we're going to be ordering more.
And the second question, what size will the checks be that will be sent out to Americans?
To be determined. We're working with the Senate right now. We're working with everybody on Capitol Hill. There's been tremendous, there really has been, I mean, with some exceptions, obviously, because it's always the way it is, but there has been, they've been getting along very well, Republicans and Democrats. It's a nice thing, very bipartisan so far.
Would you like to see them more than $1,000?
Well, we're going to see. I don't want to get into that right now, John. We are looking at different numbers. We're looking at timing that would be different, splitting the time, splitting the payments. We're looking at a lot of different things. Hasn't been determined yet, but it will shortly be determined, and people want to go big as opposed, everybody seems to want to go big, and they want to get to the recovery. The big day is, the big thing we can do is get rid of this horrible, I call it the unseen enemy. You call it, there's 1,000 different terms for it, but whatever, it snuck up on us, and it did 128 countries. I think it's in something like that, very close to that. Think of that. So it spreads violently. It's a very contagious, very, very contagious virus.
Do you consider America to be on a wartime footing in terms of fighting this virus?
I do. I actually do. I'm looking at it that way because, you know, if it got out of control, the big thing we did was a very early stoppage of people coming in who could be very, very heavily infected. That was a very good move, and it was very early, very, very early, when most people, including a lot of professionals, they didn't want us to do it. That really saved a lot of lives. And yeah, I look at it, I view it as in a sense, a wartime president. I mean, that's what we're fighting. I mean, it's a very tough situation. You have to do things. You have to close parts of an economy that 6 weeks ago were the best they've ever been. We had the best economy we've ever had. And then one day you have to close it down in order to defeat this enemy. And but we're doing it, and we're doing it well. And I'll tell you, the American people have been incredible. For the most part, they've been really incredible. Yeah, please, Caitlin.
For you, and then I have one for Secretary Wilkie as well, but I'll start with you. You just said there are a tremendous number of ventilators that we have, but for weeks, hospitals have been warning about a critical shortage that they say we are not prepared for. So why did it take so long to invoke the Defense Production
Well, you know,
Act?
hospitals are supposed to have ventilators too. And when we have thousands of ventilators, it sounds like a lot, but this is a very unforeseen thing. Nobody ever thought of these numbers. Nobody ever saw numbers like this. Even with regard to testing, normally we wouldn't be doing testing, and they decided to do it. Very, very hard to ramp up. Now we're getting highly sophisticated tests, and it's going very well, but nobody's ever heard of testing in the kind of quantities that you're talking about.
But we knew for weeks we needed more ventilators. So why did it take so
Well,
long?
we knew. It depends. It depends on how it goes. Worst case, absolutely. Best case, not at all. So we're going to have to see where it goes. But we are ordering thousands and thousands of ventilators, and they're complex. You know, these are complex machines, and but we're ordering them. Does anybody have a, Mike? Maybe you do. How many do we have?
Yeah, you said
And
you
we're
could
ordering.
access the
Please,
number.
yeah, please. Do you know the number?
We have a specific number of ventilators in the stockpile. It's in excess of 10,000, and you just heard the announcement from the Department of Defense. They'll be adding several more thousand to that. But the President, even this morning and yesterday afternoon, speaking with the largest companies in the supply chain in this country, we're hearing a tremendous spirit among industry leaders who are ready to step in and add to that volume. The stockpiles don't count all of the ventilators that exist today in the marketplace and in healthcare facilities around the country. But the President's given us a directive to make sure that our stockpile, but just as importantly, working with industry leaders, that we're securing the increase in ventilators, the increase in masks, gloves, eye protective care, garments that are all necessary to lean forward. And we're confident we'll be able to accomplish that with the incredible cooperation of the supply chain that exists in America today.
But we don't have an exact number for nationwide, how many ventilators we have?
We can give you that exact number. We'll give it to
Okay,
you.
that's what
But we're ordering a lot more.
Okay, sorry.
Yeah, go ahead in the back.
One question for the VA secretary? I have one question for
Yeah,
the
one second.
secretary.
1 second, Caitlin. We'll do it in a second.
Okay.
You'll be able
That's
to.
important.
Two questions, Mr. President. Thank you.
Yes.
The first one on the Canadian border. What was the tipping point? Friday we talked about it, and Monday you said no, we're not considering closing
No, I said
the border.
not yet. I spoke with the Prime Minister, Trudeau. Very good relationship, obviously, between us and our two countries. And no tipping point. It's just that we want to isolate from the standpoint we don't want people coming into contact, because that's the way we're going to win this war. That is so important. And we both thought it was time. Now, it's not affecting trade. It's non-essential. It's non-essential crossings. It won't affect trade at all. And it was just something we thought would be good for both countries. Yes, please.
Second question, Mr. President. How can you be sure that trade
Go ahead,
is not
please.
going to be a vector of the virus? How can you be sure that trade and everything that's being shipped from one side
Well,
to
they're
the
doing
other-
it in a very careful manner. You can only be vigilant and very professional, but it's not pertaining at this moment to trade between the two countries. Yeah, please.
We are hearing that the $1 trillion economic stimulus package could look something like $50 billion for the airlines, $150 billion in loan guarantees for critical sectors of the economy, a $250 billion payment on April 6th directly to individuals, another $250 billion payment on May 18th, again, directly to individuals, and as well, $300 billion for small business loan guarantees. Is that, in the general sense, what you're looking at?
It could be, and we're also playing with a lot of numbers, a lot of very big numbers, and a lot of very small numbers, frankly. We want to take care. We have to help everybody. It was nobody's fault. This happened. I mean, some people could say it was somebody's fault, actually. But it was nobody's fault, and certainly none of these companies that all of a sudden had no passengers in planes and had no passengers on cruise ships and all of the things that have happened. But I will say that they can't be blamed for this, and we want to keep those companies vibrant, because there's going to be a comeback very, very quickly as soon as this is solved, and it will be solved. We will win, and there will be a comeback, and it'll take place very quickly.
$250 billion, there's give or take 330 million Americans or so. If you just do the math on that, that's about $750 a person. A family of four, that would be about $3,000 on average. Again, rough math. Is that where this is headed?
Well, no, I don't want to say that, because it's a moving, these are all every number that you mentioned. Yes, we've talked about those numbers. We're also moving those numbers in both directions. So we'll let you know. It's moving along fast. Again, there's a great bipartisan effort going on that I haven't really seen before to this extent.
On the self-swab that you mentioned at the beginning of this, has the FDA approved that test?
No, they're looking at it. It's down the line, and they're looking at it very seriously. And I think it would be a great thing, because the others, to use a nice word, it's very inconvenient. It's very tough.
For you, sir. You tweeted this morning about your approval rating amongst Republicans. You have said that you give yourself a 10 in terms of handling this crisis. How do you reassure Americans at home who don't trust you to handle a crisis of this magnitude?
Well, I think we're doing a really good job. We started off with a termination of the border, the people coming in from China, where this all started. That meant I took it very seriously. And when I use the word calm doesn't mean that I'm not taking it seriously. Calm means, and we should be calm. We should be extremely calm. But, 95% within the Republican Party and over 50%. And I also have, we have very great approval numbers. I mean, people like the job that we're doing. And when you compare this to other epidemics, or if you want to use a different term, you can, but within this country, and you look at what's happened over the years, this is being handled very, very professionally. We have the greatest professionals in the world. We're doing a good job. Nobody's ever been swamped like this. And nothing's been so contagious. The level of contagion has been incredible, actually. Nobody's seen anything quite like this. Yeah, Peter, go ahead.
If I could ask you about the tests, sir, for a second. If federal officials have shipped millions of tests, as you and your colleagues have said, why, as the federal government says, have only 59,000 tests been processed to this point? We just heard from the Atlanta public health director saying that they have fewer than 50 test kits for more than 900,000 citizens.
Yeah,
Where are
well,
the tests?
I'll let Mike answer that. Deborah.
So that's a very critical question, and thank you for asking it. So the test kits that we put out last week through the approval, the rapid movement of that meeting that President Trump called less than 2 weeks ago, that has resulted in bringing our private sector to the table, because the test and the platform that was out there could only run between 4 and 12 tests per platform per day. We've now moved into platforms that can run basically tens of thousands of tests per day. So the reason I'm grateful for your question, because it allows me to point out that, of course, then there was backlog. There were individuals who had been tested, who hadn't had their specimen run because of the slow throughput. It's now in a high-speed platform. So we will see the number of people diagnosed dramatically increase over the next 4 to 5 days. I know some of you will use that to raise an alarm that we are worse than Italy because of our slope of our curve. To every American out there, it will be 5 to 6 days worth of tests being run in 24 to 48 hours. So our curves will not be stable until sometime next week. The reason I talked about Thermo Fisher yesterday is because their platform is in 2,000 laboratories. They're the ones that are putting out the 1 million tests this week that will solve the issue that Atlanta and others have brought up. I wanted to be clear. We prioritize the areas. We do county by county analyses. Based on those analyses, on what counties had more than 50 cases, we prioritize the test kits we put out, the 400,000. And that's why we're seeing a 7% plus positivity rate. We'll be able to expand that platform and reprioritize based on the accessibility of the other kits.
Mr. President, perhaps I can follow up. How are non-symptomatic professional athletes getting tests while others are waiting in line and can't get them? Do the well-connected go to the front of the line?
Well, you'd have to ask them that question. I mean, I've read. No, I wouldn't say so, but perhaps that's been the story of life. That does happen on occasion, and I've noticed where some people have been tested fairly quickly. Look, we inherited a very.
Encourage them to defer their tests to others.
Excuse me. We inherited a very obsolete system. This was a system that was out of date, obsolete, or it was a system that was never meant to take care of the kind of quantity, the number of people that we're talking about, millions and millions of people. If you go back in years past, like even recently with the flu, nobody had tests before. They didn't test the entire nation to see whether or not they had flu. They got the flu, they got better. Hopefully they got better, that was it. Now all of a sudden they do this very complex testing. What we've done is we've broken it down, we've broken up the system, but it was obsolete, and or you could say it was also a system that just wasn't meant to handle the kind of volume that you're talking about. We've rebuilt it into a system that for the future will be a very good system if you want to go this route. But this was never done before, and I would imagine it will be done in the future, but we built it into a very good system by using private companies, the great private companies. And I have to say Roche has been doing a very good job. They're doing a lot of work, a very good job. But this was an obsolete system. This was not a system that was meant to do anything like this or even near this. John?
Mr. President, a couple of things. A major trade coalition is calling on you to suspend tariffs with other countries as part of the response to the coronavirus.
Who heads that group? Those countries do, probably.
No, it's an
Go
American,
check.
it's an American free trade.
I know, I'm sure of free trade. Look, China's paying us billions and billions of dollars in tariffs, and there's no reason to do that. They haven't even spoken to me about that. China hasn't asked me to do that, but we're getting billions of dollars a year from tariffs from China, and I can't imagine Americans asking for that, but it could be that China will ask for a suspension or something. Let's see what happens. China's having a very rough time. They have their worst year in 76 years, as I understand it. They're having a very, very tough time, and then on top of it, this happened with the virus. But no, we're taking in billions of dollars a year in tariffs, and this was caused by something totally unrelated to tariffs.
And on asylum seekers and people who cross the southern border illegally, are you planning to invoke 42 U.S.C. 265, which would allow you to prohibit entry of certain people
The
across
answer is
the border?
yes.
And when will that happen?
Very soon, probably today. Yes.
Question for you and then a question for Dr. Burke.
Yeah.
On the border, firstly, are there plans to fully shut the Mexican border? And what do you define as essential travel when it comes to the U.S.-Canadian border?
Well, I think essential is medical. We have military working together. We have industry working together. And again, it's not affecting trade. So things like that. But just leisurely, let's go to a restaurant and have dinner, which a lot of people do. They come both ways. They go in both directions. That kind of thing we have ended on a temporary basis. Yeah, please go ahead. Not close it. No, we're not going to close it. But we are invoking a certain provision that will allow us great latitude as to what we do.
May I ask
Please.
two questions if I could?
Yeah,
The
go
Wall
ahead.
Street
You know what? Go
Journal
ahead. Sure.
The Wall Street Journal.
Doctor.
So I just wanted to clarify something, because just a week ago, you all were standing here telling us that unless you had sustained contact with somebody who was symptomatic for COVID-19, you really didn't need to worry. You told the president, the vice president, that if they shook hands with somebody who had this, if they took a photograph with somebody who had this, they didn't really need to worry. And yet, several days later, we're in a situation where people are being told, don't leave your houses. There are curfews saying you cannot walk alone at night after a certain time. Can you walk us through what seems like a very dramatic swing, a very dramatic disconnect from what we were hearing before to what we're hearing now?
So two things. We look at data all the time, and I know you're looking at the China and South Korea data. And when you look at China and South Korea data and you look what China and South Korea did, you can see that their curves are not only blunted outside of Wuhan, so the Chinese areas outside of Wuhan, blunted curve, and South Korea, blunted curve. If you look at their curve today, they're already on the far end of their epidemic curve. Of course, none of those countries are fully back to work, and so that's what we worry about too. Secondly, there was a series of scientific articles published, and I know you've seen them too, about surface contamination. I think none of us really understood the level of surface piece. So we're still working out how much is it by human-human transmission and how much is it by surface. And this is why those fundamental guidelines were put out that says don't expose yourself to surfaces outside the home. Basically what those guidelines are is don't expose yourself to excess number of persons who could be asymptomatic and infected, and then the person-to-person contact. And don't expose yourself to surfaces that could have had the virus on it, for which on hard surfaces, I know we had the cardboard issue about shipping, hard surfaces, not shown in fabric as much or in cardboard, but hard surface transmission. These are issues that we haven't had to deal with before with the level of respiratory infections, and that's why we have this concern, and that's why President put out the guidelines. And so it's to cover both of those pieces. That's all new science, all new models. I think many of you have the Imperial study available and looked at the impact of those. That's the first time those have been modeled as a comprehensive approach to mitigating an epidemic.
And Dr. Burks, yesterday.
Go ahead.
Mr. President, the Wall Street Journal is reporting that the administration has looked at an executive order that would expand the use of investigational drugs against the virus, but that FDA scientists are warning that this could put patients at risk.
I haven't
Is this
seen
something
the
you're
article.
looking at?
No, I haven't seen the article. We are making a lot of progress therapeutically, I will say that, but I have not seen that article, no. Go ahead.
Mr. President, we've shut down non-essential travel to Canada. Are you considering shutting down all travel to blunt the spread of the virus? And we've heard from industries like the airlines who are seeking relief. What other industries or how exactly is your administration going to determine which industries and businesses get
Well, there are
help?
certain industries that people know. I mean, the airlines would be number one if you look at what's going on. They go from having the best year they've ever had to having no passengers because of what we've had to do in order to win this war. It's a war. And so, basically, what many of the industries are. What we want to do is we want to make sure they all stay together so that after the war is one, we can immediately go right back up to where we were and even beyond. I think we're going to go beyond where we were. And a lot of people are saying that, by the way. We're poised to do that. But we have to win the war first. Yeah, please, go ahead.
Thank you. To follow up on that, Treasury proposed $150 billion today for those industries, but their proposal doesn't detail which industries would get that money and how much. So aside from the airlines, which you just mentioned, what about the cruise industry, the hotels? Yeah. How much of that money do you see them each
We're
getting?
talking about all of it. Haven't detailed it yet. We have detailed it to senators and to members of the House. We have been talking about it, and we're coming up with numbers. Haven't gotten there yet, but certainly hotel industry, the cruise ship industry, the airlines, those are all prime candidates, absolutely.
On the northern border, sir, when you say
Which border?
temporary, the northern border,
Yeah.
when you say temporary, which is what you said in your tweet, does that mean 30 days?
I would say 30 days, and hopefully at the end of 30 days, we'll be in great shape. Jeff, please.
Mr. President, I was struck by what Dr. Birx said about millennials and others perhaps not taking some of these warnings as seriously as you would like. Some of those people also seem to be your supporters and conservatives who may be quoting some of what you said at the beginning of this, comparing it to the flu. What is your message to them to really follow what you've been saying so far? And are you concerned that they're still listening maybe to some of your earlier comments rather than your more recent ones?
Well, I think my earlier comments are to be calm. I mean, I do want people to be calm because we're going to win this and we're going to win it. It's just a question of time. And I wanted to go quickly. So based on the fact that I wanted to go quickly, I hope they just listen to what we've been saying over the last period of time. We don't want them gathering, and I see they do gather, including on beaches and including in restaurants, young people. They don't realize that they're feeling invincible. I don't know if you felt invincible when you were very young, but they were feeling totally invincible or are feeling that way, but they don't realize that they can be carrying lots of bad things home to grandmother and grandfather and even their parents. So we want them to heed the advice. We mean the advice, and I think it's getting through. I do believe it's getting through, Jim.
If they're watching,
Please.
what do you say to them if they're watching? Sorry.
If they're what?
I think there are a lot of them watching, a lot of these people at home, these young people.
Well, I think I just said it.
I was going to say, what do you
Heed
say
the
to them?
advice. Heed the advice. I just said, yeah. Thank you. Thank you, Peter.
Mr. President, how long do you think
Thank
this
you,
is going to
Mr.
last?
President.
Mr. President, how long do you think this is going to last?
We'll get you next, okay? Say it.
Thank you, Mr. President. In talking about China, you've been very clear about who you think is to blame or where the origin to blame for this virus is.
Not
Senator-
think. No. I don't think. I know where it came from. I don't know if you'd say China's to blame. Certainly we didn't get an early run on it. It would have been helpful if we knew about it earlier. But it comes from China. And it's not a question about that. Nobody's questioning that.
Senator Cotton is saying that they should be punished, in so many words, for inflicting this on the American people. Do you feel that way about it?
Well, I have a lot of respect for Tom Cotton, and I know exactly what he's been saying. And there are those people that say that. So we'll see what happens. Thank you. Go ahead. It's your turn. Go ahead. Please. He's been waiting a long time. Please. You've had your hand up so nicely for a long time. It's your time.
Thank you, sir. We've seen the Chinese government kick out reporters from the Wall Street Journal, the New York Times, the Washington Post. What is your message to the Chinese when it comes to transparency at a moment where you still have reporters asking you questions here at the White House?
Yeah, I'm not happy to see it. I don't, I have my own disputes with all three of those media groups. I think you know that very well. But I don't like seeing that at all. I'm not happy about that at all. Yes, please.
You didn't correct the language, so I wonder if you agree with it. Do you believe that China is inflicting this upon our country?
No, I don't believe they're inflicting. I think they could have given us a lot earlier notice. Absolutely. Please. Go ahead, please. Go ahead.
Yeah, Mr. President, your credibility ratings are very low. There was a recent NPR poll.
Who are you asking that question?
I'm asking...
Because I see that they're very high. If you look, I'm 95% of the Republican Party. We just had a poll that was done by a very reputable group where I'm beating Sleepy Joe Biden by a lot in Florida, in the state of Florida, and in other states. So I don't really know who you're talking about. All right, Jennifer, go ahead, please.
Two questions, if you're willing, sir. Would you give us an update on your conversation with the airline executives?
Yeah.
Did you explain to them what's coming? What was their reaction?
I did, and they explained to me where they're coming from. I mean, they went from, as I said, full planes, packed, the best year they've ever had by far, to boom, one day empty because of what we have to do to get rid of, to win this war, or we would have a level of death like people haven't seen before. So they've been fantastic. I mean, they've been great. But, you know, they went from being extremely happy to being people that are running companies that are going to need some help. And we'll help them, Jennifer.
On SBA loans, would you be willing to give us an update on how that's going? We've been getting some reports that counties have been having difficulty getting
Well, it's going. I mean, there's a lot of influx to those loans, as you can imagine. A lot of people are looking at it, but we're going to be increasing funding a lot. They're very well prepared to do what they have to do, and the SBA is doing a fantastic job. She is doing a really good job, the administrator. John?
Mr. President, a couple of questions for Dr. Burks,
Yeah.
if I could. Dr. Burks, French researchers have had some luck with hydroxychloroquine in shortening the duration of disease. Is that something that might be in the arsenal of therapeutics here in the United States?
I think we're exploring every one of those issues. The president asked for a critical briefing on that today. He opened with that. It is more than that single drug. There are other drugs that individuals are looking at. Just to go back to what we've talked about many times, there is things that look really good in cell culture against the virus that may look good in small animals and then don't have an impact in humans. And so those are the pieces that we're looking at very carefully. Of course, there's always anecdotal reports, and we're trying to figure out how many anecdotal reports equal real scientific breakthroughs.
And second question, are you confident of the seasonality of coronavirus?
All we can do is look at the past to inform the future. We know what SARS looked like. We also know, and I just want to put this out, I know you can get it online, look at the curve in China and look at the curve in South Korea. Those curves were accomplished in still the winter season. And so we're trying to understand what those relationships are. We're very interested in the curves in Italy because of their different approach, and we're following every single country's curves. And so all we can do is look at prior coronavirus and prior respiratory infection RNA viruses. These are RNA viruses. When you look at flu in the Northern Hemisphere, when you look at parainfluenza and some of the other cold viruses, and if you look at SARS, that's the way the peak normally occurs. But that is a November to April. We all started later. And so you're asking me to predict based on a later start, and that's what we're trying to really look at China and South Korea to really inform that.
All right, Caitlin, go ahead.
A question for Secretary Wilkie, if you don't mind, or you could answer if you'd like. How many veterans of those that need to be tested have been tested?
Those that have needed to be tested, we believe we've caught most of them. Right now, we have 44 veterans who have tested positive. Sadly, one has passed in Portland. We are working with state labs and private companies to make sure that testing is available. Because the president had us out aggressively early, we have been in a better place than most healthcare systems in the country. I cannot predict, as Dr. Burke said, when the next surge will be, if it will be. But one of the things that we do at VA is that we prepare for national emergencies, be they national disasters or epidemics. We started preparing for this. We started stockpiling equipment. Our equipment is stable, and I think that's in large part because of the instructions the president gave me.
But do you have a number of how many have been tested out of the number that
We've
needs to be
tested
tested?
seveother hundred. I can't give you the direct.
The other day.
Yeah,
Is it
we've
higher
tested
than
several
that?
hundred. Yes, we've tested several hundred. I don't know exactly. I do know that 44 veterans have the virus. Most of those are quarantined at home.
Could you get us the number?
Go ahead in the back, please.
Thank you, Mr. President. The question for Dr. Burks, quickly. I'm trying to understand what it's about the mortality rate. Yesterday, we underlined the fact that we had reached 100 deaths. And this morning, we wake up and we're at 110. Within 12 hours, we climbed by 10%. Is it something we have to expect from now on, a 10% increase every 12 hours?
So very early on in each one of these cases, if you look at all of the countries to date, the mortality is higher at the beginning because you're diagnosing the sickest. the ones who came in quite ill. And I just want to remind the American public that still the majority, the risk for serious illness in the majority of Americans are low. But that doesn't mean that you can't transmit it to one of those higher risk groups. And that's why we're asking for all Americans to take responsibility. You're seeing mortality or deaths today from infections that occurred 2 to 3 weeks ago in general. The other thing that you're seeing is the dramatic and very difficult impact of this virus in nursing homes. And that's why very early on, the president and vice president had us come out, and CMS put those very strict rules in place. And everybody thought we were being too strict and keeping loved ones away from their family in nursing homes. If we're going to solve this with a lower death rate, we have to protect the elderly because of their percent is much higher in mortality than any other age group.
Okay. Go ahead, please.
Mr. President, there's reporting that the federal government has a plan that shows that this coronavirus outbreak might last as long as 18 months. Are you seeing those numbers? Could it
No,
just
we're not
actually
seeing
last?
that at all.
And then my second question is, there are at least one White House official who used the term Kung flu, referring to the fact that this virus started in China. Is that acceptable? Is it wrong? Are you worried that having this virus be talked about as a Chinese virus, that might
I wonder who said that.
Focus,
You know who said that?
I'm not sure the person's name, but would you condemn the fact
Say
that
the term
Kung flu,
again.
A person at the White House used the term
Just the term.
Kung flu. My question is, do you think that that's wrong, Kung flu? And do you think using the term Chinese virus, that puts Asian Americans at risk, that people might target them?
No, not at all. I think they probably would agree with it 100%. It comes from China. There's nothing not to agree. Okay, how about last question? Please go ahead.
Switching gears very quickly.
Say it.
Switching gears to a larger question here. We've seen that before the pandemic, there were a lot of Americans that were already alienated. We saw deaths of despair increasing through suicide and other things. Now, as these individuals, a lot of times in rural parts of the country, are self-isolating, what is your message to those individuals, and what do you hope that individuals, communities, and churches will do to reach out to them?
My message is to all Americans, but to those Americans who are going through a lot, we love them, we're with them, and we will not let them down. Thank you all very much. Thank you very much, everyone. Thank you. Progress being made. And I appreciate you all joining us. Last night, the FDA announced groundbreaking new policies to further increase testing, and very substantially so. All states can now authorize tests developed and used within their borders in addition to the FDA. So the states are very much involved. They have been involved from the beginning. But we're stepping it up as much as we can, and the testing procedures are going well. And within a short period of time, all of the private labs will kick in. This has never been done before, and it's going to be something I think it's going to be incredible if it's done properly. And these are great companies. These are among the greatest companies in the world, actually. So the state's going to be dealing through themselves and with local government, local physicians, local everybody. They're also dealing with us, but we have a tremendous testing capacity. Today, we're also announcing a dramatic expansion of our Medicare telehealth services. Medicare patients can now visit any doctor by phone or video conference at no additional cost, including with commonly used services like FaceTime and Skype, a historic breakthrough. This has not been done before either. In addition, states have the authority to cover telehealth services for their medical patients. And by doing this, the patient is not seeing the doctor per se, but they're seeing the doctor, so there's no getting close. During this time, we will not enforce applicable HIPAA penalties so that doctors can greatly expand care for their patients using telehealth. So the penalties won't be enforced. We encourage everyone to maximize use of telehealth to limit exposure to the virus. It's been a very successful method of communication, but never used on a scale like we're going to use at telehealth. And you'll be able to also better maintain hospital capacity by doing this. Earlier this morning, I spoke with executives from America's fast food industry, Wendy's, McDonald's, all of the big ones, Burger King, and they were great. We're talking about the pickups in light of yesterday's guidance you heard. To avoid eating or drinking at bars, restaurants, or public food courts, we discussed the important role that the drive-through pickup and delivery service can play in the weeks ahead. So that's happening, and they have been fantastic. They have been absolutely fantastic, and they've been doing it already, but they're keeping it open, and smaller staffs, very capable people and very capable companies, and they're doing it, pickups. Our guidance yesterday urges Americans to take action for 15 days to help stem the outbreak. So it's a 15-day period. I guess now would say it's a 14-day period. It's 15 days from yesterday, and we're asking everyone to work at home if possible, postpone unnecessary travel, and limit social gatherings to no more than 10 people. By making shared sacrifices and temporary changes, we can protect the health of our people, and we can protect our economy, because I think our economy will come back very rapidly. So it's 15 days from yesterday. We'll see what happens after that. If we do this right, our country and the world, frankly, but our country can be rolling again pretty quickly, We have to fight that invisible enemy that, I guess, unknown, but we're getting to know it a lot better. Today, the Senate has taken up coronavirus legislation that includes free testing for those who need it, as well as paid sick leave and family medical leave for workers affected by the virus. We're also committed to getting small businesses the support that they need. In fact, one of the things we talked about with the fast food operations, we spoke to the chairman and CEOs of all of the companies, but one of the things we discussed is exactly that, getting small businesses support and flexibility that they need for themselves and for their workers, and that's being worked on right now. At my direction, Secretary Mnuchin is meeting today with senators on additional stimulus packages. I can tell you he was meeting with them late until the night last night, and for a big part of the day yesterday, and tremendous things are happening. There's great spirit, tremendous spirit, and I can say that for Republicans and Democrats. I can say that with respect to Governor Cuomo, we had a great talk this morning. We're both doing a really good job, and we're coordinating it. And we agree, different states need different things, and we agree on that 100%. But we had a very good talk, and I think we're right down the same track, and it's going to be very successful. New York has a pretty big problem. I guess would be the #1 hot spot. That's no fault of anybody's. It's just the way it is. But we're working very closely together. We're also getting FEMA very much involved. They've been involved, but now we're getting them to a different level. And we'll have everything ready. We're dealing with the Army Corps of Engineers should that be necessary. We have them working in some cases, on standby in other cases. But my conversation with Andrew Cuomo was a very, very productive one and a very good one. I appreciate that. We're giving relief to affected industries and small businesses, and we're ensuring that we emerge from this challenge with the prosperous and growing economy, because that's what's going to happen. It's going to pop. One day we'll be standing possibly up here. We'll say, well, we won. And we're going to say that. Sure as you're sitting there, we're going to say that. And we're going to win. And I think we're going to win faster than people think, I hope. Later today, I'll meet with the leaders from the tourism industry, as well as industrial supply retailers and wholesalers, to discuss their critical roles. As you know, I met with the department store people, all of the retailers, the big ones, including Walmart and others. And it was a great meeting. They're stocking up their stores like they've never stocked them before. We're trying to get people to actually buy less, if that's possible, buy less. Don't take everything, just buy what you need for a while. They're going to stay open all hours of the day, and they've been fantastic. We're taking aggressive action now as one nation and one family so that America can rebound stronger, frankly, stronger than ever before. And we recognize that while many American workers can work from home, many others cannot. Many of our healthcare providers, first responders, and men and women in the food service and manufacturing are showing that they're showing up and standing up to provide us with the goods and services we need. So we want people to stay home where they can, but in many cases, when you talk about food service and manufacturing, certain items in particular, they're going in and they're practicing all of the safety rules and regulations that we talk about. So with that, I'd like to just introduce our great Vice President, Mike Pence. He'll say a few words, and then I'll make some other introductions. Thank you very much.
Thank you, Mr. President, and good morning. It should be very clear to the American people that President Trump has initiated not only a whole-of-government approach, but a whole-of-America approach. And the President's interaction even today and through the course of this day with leaders in industry around the country reflects that we're not only bringing the full weight of the federal government to bear, but the full weight of the American economy. And I know I speak on behalf of the President when I say how inspired we are at the way the American people have stepped up and the way that American businesses, large and small, have stepped up. It's truly been inspiring. Our task force met this morning. We continue to focus on President Trump's priorities of testing, prevention, and supplies. And in that category, I'm pleased to report that while testing is available in all 50 states, as the President just indicated, through the swift action of the FDA at the encouragement of governors around the country, now state health authorities can authorize labs in their state and expand existing testing capabilities. But also in connection with the FDA's action, which you'll hear more about in a moment, we now have continued to expand the public and private partnership that the President forged with vast commercial laboratories around the country, increasing access to the high-volume, high-throughput coronavirus testing that is greatly expanding access even as we speak. Also, our task force received a report this morning on the progress that the U.S. Public Health Service and FEMA are making, working closely with state governments and also partners in the private sector like CVS, Target, Walgreens, and Walmart to expand remote testing sites around the country, and we'll have a full report later this week as those come online. It's important the American people understand that testing is happening all over the country. But all of our health experts wanted me to tell the American people, you don't need the results of testing to know what you should do. And President Trump's 15-day coronavirus guidelines are advice for every American in every community. They're the result of the best guidance of CDC and our health experts. And as the President said, we continue to urge every American over the next 15 days to put into practice the principles in the President's coronavirus guidelines. By every American practicing these principles, we believe that we can slow the spread of the coronavirus. In fact, our experts have told our task force that if every American acts on the President's coronavirus guidelines, we could see a substantial reduction in the spread of the coronavirus. But as the President said, it will take all of us to do it. And so if you feel sick, stay home. If someone in your house tests positive, keep the entire household home. Especially if you're a person with an underlying health condition, we urge you to stay home and practice social distancing from people. No social gatherings of more than 10 people. Use drive-through, as the President discussed with leaders in the industry today, and every American, especially practicing common sense and good hygiene. For the American people as a whole, the risk of serious illness remains low, but we're asking every American to partner with us in this effort to slow the spread of the virus and especially to be mindful of seniors or others with serious underlying health conditions for whom the threat of the coronavirus can be very significant and very real. As I said, the President has continued to push our task force to bring a whole of government, a whole of America approach, and we continue to be inspired the way our nation's governors and nation's businesses are responding. We spoke just yesterday with the leaders of every broadcast network in America that will soon be unveiling a public service campaign using CDC guidelines. And specifically, as we work on the issue of supplies, meetings yesterday with Department of Defense officials about excess supplies. The President and I will be meeting today to speak about the supply chain for hospitals. We would make one specific request, and that is we would urge construction companies to donate their inventory of N95 masks to your local hospital and forego additional orders of those industrial masks. Because of what the President asked to be included in legislation moving through the Congress today, those industrial masks that they use on construction sites are perfectly acceptable for healthcare workers to be protected from a respiratory disease. But we're asking construction companies that our President knows very well from his background, we're asking them to donate their N95 masks to their local hospitals and also forego making additional orders. At the President's direction, we will continue to do whatever it takes. We'll continue to marshal the best of the American people, the best of all the people behind me, the people behind them, our state and local officials, and we will get through this, and we will get through this together. Thank you, Mr. President.
I want to thank Chad Wolf and Homeland Security. The job they did at the airports was really incredible. They screened thousands and thousands of people. O'Hare got backed up a little bit, but they got him out. But everybody was screened and screened very carefully. They didn't want to rush it. I think it was 13 airports, and it was an incredible thing. Then they had a big surge also from the UK and Ireland, and that went very smoothly. But they did a fantastic job. They worked long hours, and they did a fantastic job. I'd like to introduce Steve Mnuchin, and then I'm going to ask Steve to leave because he's going to the Hill. He's been working very hard with the Senate and with the House on a very, very big, bold package. It's going to be big and it's going to be bold, and the level, again, of enthusiasm to get something done, I don't think I've ever seen anything quite like it. So, Steve Mnuchin, please.
Thank you, Mr. President. I'd like to announce some very significant actions that the President has approved today. The first I would say is earlier today, I sent a letter to Fed Chairman Powell approving his request to use 13.3. And what that will do is the Fed will be setting up a special purpose vehicle, which the Treasury will invest $10 billion in from one of our funds. That will enable the Fed to guarantee the purchase of A1, P1 commercial paper going forward. That is a $1 trillion market and is critical to American workers, it's critical to American business, and it's critical to American savers who have a lot of that money in money market funds. So we heard loud and clear there were liquidity issues. This is very significant and will create, I don't think we'll need to use it all, but we have the ability to have the Fed purchase up to $1 trillion of commercial paper as needed. That has already created significant stability in the market today. The second thing I would say is, we've previously talked about deferring IRS payments. The President earlier this morning authorized me to announce this program. I have previously announced we would defer $200 billion. The President suggested we increase that to $300 billion, which we will be doing. Now, let me just be clear on the specifics. We encourage those Americans who can file their taxes to continue to file their taxes on April 15th, because for many Americans, you will get tax refunds, and we don't want you to lose out on those tax refunds. We want you to make sure you get them. Many people do this electronically, which is easy for them and easy for the IRS. If you owe a payment to the IRS, you can defer up to $1 million as an individual. And the reason why we're doing $1 million is that covers lots of pass-throughs and small businesses, and $10 million to corporations, interest-free and penalty-free for 90 days. All you have to do is file your taxes. You'll automatically not get charged interest and penalties. Now, of course, any American has the right to extend their taxes. We're not taking that right, but the President has asked us to go up to $300 billion. That's also an enormous amount of liquidity in the system. The third thing is the President and I worked on a very significant economic stimulus plan. Thank you for being available last night and throughout this morning, and I will be presenting that to the Republicans in the Senate this morning and also discussing that with the House. We look forward to having bipartisan support. We're now working with the Senate to pass this legislation very quickly, and these will be payments to small businesses. We've talked about loan guarantees to critical industries such as airlines and hotels. And we've also talked about a stimulus package to the American worker. You can think of this as something like business interruption payments for the American workers. Thank you.
Do you have any questions for the Secretary of the Treasury?
When you say a stimulus package for American workers, do you mean direct payments to Americans, or are you talking about a payroll tax holiday?
Although the president likes the idea of the payroll tax holiday, I will tell you what we've heard from many people, and the president has said we can consider this. The payroll tax holiday would get people money over the next 6 to 8 months. We're looking at sending checks to Americans immediately. And what we've heard from hardworking Americans, many companies have now shut down, whether it's bars or restaurants. Americans need cash now, and the president wants to get cash now. And I mean now, in the next 2 weeks.
How much?
I will be previewing that with the Republicans. There's some numbers out there. They may be a little bit bigger than what's in the press.
Go ahead, please. Please, wait, please.
What help are you going to give to airlines specifically?
I've had discussions with all the airline CEOs this week. The airline CEOs have had conversations with the Senate and the House. As the president said, I was up with a subset of the Republican senators last night. I've discussed that with them. I think, as you know, this is worse than 9/11. For the airline industry, this is, they are almost ground to a halt. The president wants to make sure that although we don't want people to travel unless it's critical, we want to maintain for critical travel the right to have domestic travel.
$60 billion, is that enough?
I'm not going to comment on the specifics. I will tell you we're very focused. There's a lot of workers. This is strategically important to us, and we'll be working with Congress on this.
The airline industry will be in good shape. Yeah, go ahead, please.
There's been talk about $1,000 checks to every American, increasing support among Republicans and some Democrats for that. Would you support that going to everyone, or would you support some sort of income restriction on who gets a check?
Well, I think it's clear we don't need to send people who make $1 million a year checks, okay? But that's one of the ideas we like. We're going to preview that today, and then we'll be talking about details afterwards.
Well, I think we're going to do something that gets money to them as quickly as possible. That may not be an accurate way of doing it, because obviously some people shouldn't be getting checks for $1,000. And we'll have a pretty good idea by the end of the day what we're going to be doing.
Mr.
Secretary,
Yeah, John,
Can you tell, how would the mechanics of this work? I mean, we've been talking about a payroll tax holiday, some $500 billion worth was floated to me today. But so how would this idea of sending people a check work? Would that be sort of an advance on what they would pay in payroll tax?
Again, we want to make sure Americans get money in their pockets quickly. We want to make sure small business owners have access to funds. We want to make sure that hotels, airlines, we have an entire package. We'll be laying out those details later today.
Yeah, I have to say this. There are 4 different ways you can do it. That's okay. 4, you can hear me well enough, I imagine.
Sorry.
Okay. People at home, you're right. Those are very important people. Come to think of it, especially your people. Look, we have 4 or 5 ways we can do it, 4 ways in particular. I think there's a 5th possibility, but there are some very good ways of getting the money out and getting it out quickly. Payroll tax is one way, but it does come over a period of months, many months, and we want to do something much faster than that. So I think we have ways of getting money out pretty quickly and very accurately. Okay?
Can you talk about the timeline, please? How quickly do you think you can get this done? And
The president has instructed me we have to do this now. So this is now.
By the end of the week?
We are going to work with the Senate, who's in session right now, actively. We will continue to have conversations with the House. I've already spoken to Speaker Pelosi once today. This is stuff that needs to be done now. The president has instructed me that this is no fault to American workers. For medical reasons, we are shutting down parts of this economy, and we're going to use all the tools we have, as I've said, and what tools we don't have, we're going back to Congress. I got to go back to
$850 billion. To those who might be concerned that's too expensive?
We don't want to talk about it, but it's a substantial number. We're going big. The expression, we could do it 2 ways. We could keep going back every day or every week. We're going big, and that's where Mitch McConnell, that's the way he wants to go. That's the way I want to go. I think we want to get it done and have a big infusion as opposed to going through little meetings every couple of days. We don't want to do it that way. We want to go big, go solid. The country is very strong. We've never been so strong, and that's what we're going to be doing. We don't want with this invisible enemy. We don't want airlines going out of business. We don't want people losing their jobs or not having money to live when they were doing very well just 4 weeks ago. So we're going big, and that's the way it'll be, and that's the way everybody seems to like it on the Hill. Any other questions for Steve?
Sorry, in addition to airlines and hotels, you had a call with restaurants today. Was any type of emergency assistance discussed on that call? A lot of restaurants have to close. Even if they are doing delivery, they're not making as much money as they would with a full house.
Well, let me make two comments on the restaurants, and the President understands this. This was emphasized this morning. First of all, we want to make sure that the states allow the drive-through portion of these fast foods to stay open, particularly in a time period where we're telling people don't go to restaurants. These companies feed a big part of America, and I expect they're going to feed a bigger part of America. The second thing they asked me to emphasize, I wasn't going to do it now, but as long as you asked, many of these companies have apps. You can order ahead of time. That way when you get there, it's as simple as they'll have it packed. They can give it to you with social distancing, and it'll be very fast. So we expect that they will be able to feed a large part of the population. And in regards to support, I will say a lot of these businesses are small businesses, are companies, franchisees, 500 or less, and we have a specific program we'll be unveiling that helps all businesses, small and medium-sized businesses of 500 and less.
Secretary, real quick question regarding Marriott Corporation. It announced that it is furloughing thousands of individuals because of the impacts of the coronavirus. Will your legislation help those individuals?
I hope so. That's one of the reasons why we got to act very quickly, because we understand whether it's the airlines, hotels, for good reasons, to protect the United States on medical issues. These businesses are shut down, and the President wants to make sure, as I've said, we will use all the powers we have. You saw this today, $1 trillion of potential liquidity into the market, and the powers we don't have, we're going to Congress, and I will say there's a lot of bipartisan support for these issues. So I'm going to apologize because I have to go deal with some other things, if that's okay, Mr. President.
Thanks, Steve.
Oh, yeah, I do want to comment on this, okay? We absolutely believe in keeping the markets open, okay? Americans need to know they have access to their money. After September 11th, the only reason why the markets were closed was because the technology was disrupted. I've been on the phone with the major banks, with the New York Stock Exchange. Everybody wants to keep it open. We may get to a point where we shorten the hours if that's something they need to do, but Americans should know that we are going to do everything to make sure that they have access to their money at their banks, to the money in their 401ks, and to the money in stocks. So I want to just be very clear, we intend to keep the markets open.
And the banks are record-setting strong, so we have that, which is a much different event than what we had not so long ago. John, go ahead, please.
Mr. President, you mentioned the Army Corps of Engineers.
Right.
That you've had a conversation with Governor Cuomo.
Right.
He believes that New York is going to run out of hospital beds. Are you prepared to mobilize the
Well,
Army
we've
Corps
been asked to
increase capacity?
Yes, we're starting to. We're starting the process, and it's a process. We hope it's not going to be necessary, but it could be necessary. The state is working on it very hard themselves, but we'll probably supplement what they're doing.
And given that many of the precursors for our pharmaceuticals come from China, and there have been supply disruption, that supply chain has been broken to some degree. Do you expect that we could run into a shortage of prescription drugs?
No, I don't see that at all, and I think China has every incentive to make sure that things work well. China wants to make sure that things work very well. They have every incentive to do so. John?
Mr. President, the governor of Ohio has called off the election that was supposed to happen today, the primary election. Do you agree with that decision, and what steps are you taking to ensure that elections going forward, if this pandemic continues, that elections will be able to happen, including, of course, the big one in the fall?
Well, the governor of Ohio is doing a great job. He called that off, and we'll see what happens. There's a court case, and it hasn't been fully determined yet. But if he called it off, I could understand that, because he's definitely somebody that knows what he's doing. We'll be seeing what very soon. They're going by the rule of 10 as opposed to 50, and that's pretty tough. I would say probably you could violate that if you wanted to for an election. I just think an election is a very special thing. He chose a different date, I think a date sometime in June. But that would be a decision that would be made by him. He felt it was necessary. The courts somebody's challenging it, so the courts will ultimately decide.
But what are you doing to ensure that further elections, if we're still in this situation a month from now, 2 months from now,
what I'm doing, John, is very simple. We're getting rid of this virus. That's what we're doing. That's the best thing we can do. By the way, for the markets, for everything, it's very simple solution. We want to get rid of it. We want to have as few deaths as possible. This is a horrible thing. You look at what's going on with Italy. We don't want to be in a position like that, but a much larger, because we're a much larger country. We don't want to be there. And I think we've done really well. I think we've done well. I think the states have done well. We're all working together. The best thing we can do is get rid of the virus. Once that's gone, it's going to pop back like nobody's ever seen before. That's my opinion, but I think it'll pop back like nobody's ever seen before. Please.
Mr. President, just to follow up on John's question, specifically how many new hospital facilities could the Army Corps of Engineers build? And also, what specific measures are you taking to try to increase the number of ventilators in the stockpile?
Right. We've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment, but compared to what we're talking about here, this has never been done before. And yesterday I gave the governors the right to go order directly if they want, if they feel they can do it faster than going through the federal government. Now, we've knocked out all of the bureaucracy. It's very direct, but it's still always faster to order directly. And I gave them, that was totally misinterpreted by the New York Times on purpose, unfortunately. But it's very important. Yes, Mike?
I could amplify.
Yeah, please.
Yeah, thank you. The President directed us to work with the Department of Defense. There's two ways that DOD can be helpful in terms of expanding medical capacity. I know the governor of New York has asked us to look at the Army Corps of Engineers, which could perhaps renovate existing buildings. But the President also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly. We spoke with Governor Inslee yesterday in Washington State. We have resources in that part of the country that we could move. And as governors make these requests, we will process them, bring them to the President. But there are two different lanes that DOD can provide, in addition to many medical supplies to augment our national reserves. And the President has tasked us to evaluate, make available, and to consider every request from governors for either field hospitals, expanding facilities, or the Army Corps of Engineers that could retrofit existing buildings.
The Army Corps is very prepared to do, as we say, and we're looking at where it's going. But, and they do call them MASH hospitals, but the field hospitals go up very quickly. We have them. We have all of this equipment in stock, and we're looking at different sites in a few different locations. And we're not going to need them in West Virginia, where so far I guess they have none. Still none? Still none, right? West Virginia. Big Jim, the governor's, he must be doing a good job.
Or is that just reported?
That's what's reported.
No, but is that a reporting issue, or is that they have no cases?
Well, that's all that, I just see West Virginia is the only one that has no cases. So obviously that's being treated differently than in New York or California, different parts of California. I do say this, though, the Army Corps of Engineers is ready, willing, and able. We have to give them the go-ahead if we find that it's going to be necessary. We think we can have quite a few units up very rapidly. I'm going to work with Governor Cuomo. I'm going to work with a number of the governors. Governor Newsom has been very generous in his words, and I'm being generous to him too, because we're all working together very well. And I think a lot of very positive things have taken place. We're talking to California about different sites, but we can have a lot of units up fairly quickly if we think we need them. I think what I'll do is I might ask Seema to say a few words on the telehealth, and then we can get back to this, please. Seema?
Thank you, Mr. President. And as the President announced earlier, we are doing a dramatic expansion of what's known as telehealth for our 62 million Medicare beneficiaries who are amongst the most vulnerable to the coronavirus. And we're acting in accord with the appropriations bill that was signed on March 6th, as well as the President's emergency declaration last week. And this action is a part of our broader effort to ensure that government requirements, rules, and regulations don't get in the way of patient care during an emergency. And today's announcement builds on the significant progress that the President has already made over the past 3 years around telehealth services. And while we have allowed for virtual check-ins, full telehealth benefits have been restricted to those living in rural areas, established patients, and just for those brief visits. But no longer, Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home. And these services can also be provided in a variety of settings, including nursing homes, hospital outpatient departments, and more. And thanks to the leadership of HHS, we'll also be temporarily relaxing certain HIPAA requirements so that doctors can provide telehealth with their own phones, and we'll be using enforcement discretion when it comes to collecting copays so that cost won't be a barrier. This is a part of our larger efforts around mitigation, and as we are encouraging Americans to stay home whenever possible, we don't want our Medicare policies getting in the way. And so consider the implications of this. Perhaps an elderly patient with diabetes needs a routine checkup, and this has nothing to do with the coronavirus. And so with our new telehealth benefits, this person who's not really, who's at risk for the coronavirus doesn't have to venture outside their home. They can talk to their doctor via Skype, and they don't have to risk exposure to the virus, and they can receive that care from the safety of their own home. It could be another Medicare recipient who's experiencing mild flu-like symptoms, and instead of leaving the house and sitting in a waiting room full of other vulnerable people, they can also receive advice from their doctor from their home. And this shift is very important for clinicians and providers who over the coming weeks will face considerable strain on their time and resources. And now Medicare patients who don't absolutely need to come in to an office won't have to, and this allows the healthcare system to prioritize for care for those that are that have more needs or in dire need, and preserves protective equipment as well. State Medicaid agencies can also provide telehealth services without federal approval, and so we're asking all states to make this available as well. And we've also asked private insurance companies to expand their telehealth benefits and make it clear to their providers and their members what they cover. As our nation seeks to balance the twin imperatives of getting Americans the care that they need during this outbreak and limiting the spread of the virus, the impact of this historic action simply cannot be overstated. In an emergency, those on the front line shouldn't have to worry about federal rules and red tape, hamstringing them when they need flexibility above all else. And we're doing everything in our power to make sure that that doesn't happen. I also just want to briefly mention that because of the President's emergency declaration, we do have the ability to provide a lot of Medicaid waivers, and Florida was the first state to be approved. We were able to do that in a matter of days. Thank you.
Any questions, please?
Where do senior citizens go for instructions on how to do the telehealth?
They should call their doctor's office, and their doctor's office can tell them how to do that. Also, there may be some of our Medicare members that may not have access to equipment, so we're asking family members to help with this, but also respecting the requirements around social distancing, and if any of those family members or neighbors have symptoms, they should obviously stay away.
Will you be posting numbers also?
That's correct,
That might
exactly.
be the easiest way to do it.
Yes.
If you post in ads, if you post some numbers.
And they can also call our 1-800 Medicare number, and they can also get information. Those phone lines are open.
Thank you. Thank you very much. Admiral, if you'd say a few words about where we're going, and then I'd like to ask Dr. Birx to say a couple of words, but how the system's working.
Well, thank you very much. As we talked about earlier this week, the commercial system is rapidly advancing in the testing capabilities. As of today, our public health laboratories, meaning the CDC and the public health labs, have reported out 31,878 tests, so almost 32,000 tests. The clinical laboratories, the Association of Clinical Laboratories, have reported out about 27,000 tests, and most importantly, of those 27,000 during the cumulative period of time, 8,200 of them were yesterday. This is showing the dramatic ramp as the high throughput comes in. We don't have the numbers this morning from the American Hospital Association, which means all the individual hospital laboratories. We will have that upcoming in the next day or so, and then Ambassador Birx will have this whole process fixed with the legislation that everything will roll up into a common reporting probably by the end of next week. In terms of our drive-through laboratories, again, these are blossoming all over the country by individual states. The ones that we are heavily involved in and really pushing equipment to, we expect over the next few days to begin setting up 47 of these in approximately 12 states. The material is already palletized and being shipped to the locations. Most cities have the specific locations. Some do not, but it's still going to a central receiving. And we know that we'll be deploying at least 140 Commissioned Corps officers. About half of the sites have reported their requirements. About 140 officers will be going. We expect that to go up. So this is going on the way we expected. We did a trial site yesterday with a full mobile unit for drive-through with full PPE. We had a lot of kinks in the system, as you can expect. That's why we do a test before we go out into the field. Don't expect these to be 100% perfect the moment they come. They're going to be adapted to the state and the local situation, but we're very confident that these will add testing to the already very robust healthcare system and commercial system. Thank you, Mr. President.
Thank you very much. Thank you, Admiral. And this has never been done before, and it sets a great roadmap for future. Should we have something like this in the future? I hope we don't. But it's never been done before, and they've done an incredible job. And again, we're working with the states and relying on the states. We have to, because they have, it's point of sale, it's point of sight, and we're in, I think, just about every instance getting along really well with the states. If I could, Dr. Birx, if you could say a couple of words, please.
Great, thank you. Thank you, Mr. President. So I think what you've been hearing from us is to find solutions that are high quality and sustainable based on the frontline workers and governors' requests. And those come in on the governor's call. We've been immediately responsive to those. And that's the level of red tape and bureaucracy that we have removed. I think that point about sustainability and quality is very important because, as the President says, we're creating a roadmap for a different level of functionality for future pandemics. Our flu pandemic preparedness plan was a plan. Now we're seeing where we have to revise, where we have to create new avenues of research, new avenues of work to really ensure that the need of the American people can be reached. We were adamant about having a high-quality test based on our commercial vendors. Over the next few months, you will begin to see that other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives. These tests were studied and studied by the FDA to really ensure that they are that level of quality, and we've given the states the permission to ensure that same level of quality. Now, I want to just say 1 minute on the testing. Testing should not be used as an assessment of your risk. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between, to really ensure that you're following these guidelines. We hear every night of people who are not in work, moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. So every single generation has a role to play. We're asking our older generation to stay in their homes. And we're asking the younger generations to support them in social contacting through videos and other Skype-type functions, or just the simple telephone. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts. I heard an innovation last night and this morning again on the news. I really want to applaud the private sector who are now creating senior-only shopping times. I think that's extraordinary. I think that shows what America brings, and I think other countries will learn from us about how to really protect seniors in this type of way. I'm hoping that carries through to next year when we have our flu epidemic, where we can really have a very different profile of the amount of mortality that we have during flu that we never talk about. Anywhere from 15,000 to 45,000 individuals are lost every year. If we learn how to do this well and sustain some of those core changes, we can change the way respiratory viruses, not only for this, but the future, affect Americans.
It's a big thing.
A question on the clinical data. So we've had now roughly 5,000 people test positive. We've had 90 deaths or so. When are we going to know the data of who those people are, who has been infected, what the ages are, what the pre-existing conditions are, how serious it was, both for those who have been tested positive, but also those who have died?
Well, you are singing my sheet of music. I'm very data-oriented, so thank you for bringing up this issue of data. I really want to applaud HHS. We had a discussion about this several days ago. They've made calls into Seattle and California to really understand that, and also importantly to understand how many of their patients needed ventilators, how many of them needed oxygen support, how many of them needed and what they needed. Could we predict early someone who was going to have a more difficult course? These are all the questions we're asking and answering right now. We did get an early report back from Santa Clara and Seattle. We're digesting it. We just got it this morning. We're looking at that carefully because we think that roadmap is very important to other communities. We have not discussed this with New York yet. We do know from other countries, and that all is available online, that profile. You can see that mortality under 30 is extraordinarily low. The mortality across the board outside of Wuhan is now settling somewhere around 0.7, but that should not be reassuring because it's much higher in people with pre-existing medical conditions, even if young, and people that are older with pre-existing medical conditions. And so we still want every American focused on doing what they can do today to change the course of this pandemic.
Will you commit to making that data public so we will all know?
We're committed not only to making it public, but to have a website that everyone can see in real time.
Dr. Birx, if I could just follow up. You all are signaling a much more aggressive posture toward containment mitigation now. And many states have been very aggressive. But there is a small number of states that have not issued public guidance to their residents. Is it important for the success of the effort that 100% of the states be forward-leaning on this? And if so, Mr. President, what would be your message to those states that have not?
Okay. So that's why the Vice President and the President yesterday issued those critical guidelines. As I said this morning on Fox and Friends, you can look at them as guidelines, you can look at them as requirements, and you can look at them as the president asking every American in every state to follow those. That's why we put them out at the federal level. We wanted to make sure every American knew what they could do today to change the course of this epidemic. I think it's empowering. I think it says all of us have a social responsibility to each other, and that's why we believe that every mayor and every governor should be instituting these guidelines that came from the White House and the President of the United States.
And we've been very tough in those states. I know exactly who you're talking about. We've been very tough in them. Thank you. Please, go ahead.
Just a follow-up question on the testing. You've been telling us for days now that millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just at 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology push out those tests. Because we can only make them available. Groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for orders.
And is that where the issue is, getting the tests out, or is it getting the tests conducted?
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the issues related to getting the test conducted. Obviously, that does take time. He is working on innovative solutions that are creative and sustainable that will be a game changer in testing, but we don't have the data yet. This is a critical comparator. Can you do it yourself? Can you actually sample yourself? These are the kinds of things we're working on right now, and he's getting the data for us.
And the states are actually doing a lot of it. The governors and the states are doing a lot of it, with even our tests. Yeah, go ahead. Go ahead, please.
Okay, thank you. Can you give us a sense of how long these tough new restrictions will need to be in place until we start to see the rate of this virus going down? And also, can you speak to this study that as many as 2.2 million people in the United States could die if there weren't this type of action by the government taken? To what extent did that prompt what we saw yesterday?
I think, models are models, and they're based on input, and they're based on infectiousness without any controls. I can tell you we've never seen that level of infections that modeled up to that 2.2 million in mortality. So we are looking at that. We are having a particularly model meeting tomorrow. I think that's really going to be important. I've dealt with a lot of modelers in my time. They're wonderful people. But they all have their favorite inputs and they all have their favorite integration functions. So we're evaluating all of those so we can integrate and create the best model for the United States based on the best data. And that first set of recommendations you saw were based on what we could do today to prevent anything that looks like that. If I could just say one other thing to the hospitals and dentists out there. Things that don't need to be done over the next 2 weeks, don't get it done. If you're a person with an elective surgery, you don't want to go into a hospital right now. There's a lot of distraction. There's a lot of people doing a lot of other things to save people's lives. So let's all be responsible and cancel things that we can cancel to really free up hospital beds and space. And then let's do everything that we can to ensure that we don't need the ventilators because we protected the people who would have needed to use them.
And are you looking at the possibility of more actions like, for example, limiting travel within the United States? Are you looking
It's possible. It's possible. We'll see how it goes. I think there's been great cooperation with local governments, states. We'll see how it goes. It's going right now pretty well. Yeah, please, go ahead.
Can I follow on that, Mr. President,
Please.
very quickly?
Yeah.
Just very quickly. Do you need to invoke the Defense Production Act to get more of those medical supplies to different hospitals?
Well, we're able to do that if we have to. Right now, we haven't had to, but it's certainly ready. If I want it, we can do it very quickly. We've studied it very closely over 2 weeks ago, actually. We'll make that decision pretty quickly if we need it. We hope we don't need it. It's a big step.
Need more help from the federal government when it comes to those supplies.
When you say the states,
to those
in particular, 3 states need some help, and some states, have 2 people, 3 people, no people, in the case of, again, West Virginia. So we're looking at it very closely. We've taken it apart 15 different ways. It's a very difficult thing to do. It's a very big step, and if we need that step, we'll take it. Okay?
Quick follow on Kristen's first question. A lot of people have got travel to places that aren't considered hotspots,
Yeah.
Caribbean, Mexico, that sort of thing over the next few weeks. Would you recommend that they follow through with those plans?
I would just say, enjoy your home stay. I would just say right now, we have to get this problem fixed, and then we'll get back into business really quick. We'll open up our country, we'll open up our society, the world will hopefully open up. We see areas of the world that haven't done well, and we see areas that are doing very well, and I would put us in the category of doing very well for a country so big. I think that I would recommend that they just enjoy their living room. John? Yeah, go ahead, please.
What do you say to people who are not heeding these guidelines from the White House? And then also I have a question on asymptomatic people,
Sure.
Dr. Burks.
I'm not happy with those people if they're not. But those people are being shouted down by other people. They know it. They're being, it's almost like self-policing. People went in, there were a couple of instances, I guess, probably more than a couple, where people are not happy when they see others doing what they're not supposed to be doing. We have to get rid of this. We have to win this war, and ideally quickly, because the longer it takes, it's not a good situation. And I'm not even talking about the economy. I'm talking about the lives of a lot of people. Yeah, please, did you have one?
Will the White House put any restrictions on corporate bonuses for companies that do get bailed out, like airlines?
I'm going to ask, I think I'm going to ask Mike, answer that question.
I think it's all a work in progress. What President Trump has made clear to industries around the country is that we're going to do whatever it takes. We understand this is an extraordinary moment in the life of our nation. It's the reason why the President brought in leaders of the financial sector, airline industry. He'll meet with all additional industry leaders today in tourism and hospitality. But he has tasked the Secretary of the Treasury to work with members of Congress in both parties to make sure that we construct the kind of economic support that will allow those industries to weather the period of the coronavirus and then to come back stronger than ever before.
We've had such incredible. I don't know. It's almost the word spirit is the best word. It's like a spirit. The banks have come in, and the banks are doing things that they would have never done. They're working on extensions and lots of things that they wouldn't have done. Co-pays with regard to the insurance companies. I mean, for them to be doing what they're doing, you know all about the co-pays. They would have never done that, and they did it. They were in my office. They, I would say, the 11 biggest in this country. I guess probably the 11 biggest in the world, the big ones, all the big ones, and they did things on copay that nobody would be doing, that they wouldn't have done in a million years, but they're doing it. There's a great spirit going on right now in the country. So you want to, yes, please.
Dr. Fauci, you've said you like being accused of overreacting because that is an indication we may be doing things necessary to beat this, bend the curve. Right. How long do you think it will take for you to be confident that yes, we're bending the curve, or no, we're not?
You know, I can't give you a firm number on that because the dynamics of outbreaks in some respects are predictable historically. They do this and that. We don't know because this is really unprecedented. I mean, of all the outbreaks that I've been involved with over the last at least 36 years and then going historically back, we've never had a situation where the mobilization of all the different components, travel restrictions, internal containment, mitigation, financial assistance, public health assistance, testing. So we don't really know. But the one thing I do know that if you look at models with all of their vicissitudes of models, is that when you have input into the kinds of mitigations and things that we're doing, we're going to see a hump instead of a peak. I would be really surprised if all the things that we're doing, and this is really a comprehensive approach. I was struck as I was listening to everyone make their presentations that, you know, I'm a scientist, I'm a health person, and I'm a physician who sees patients. So I look at it from one particular standpoint. But what I'm being impressed by is that this is really a comprehensive thing that has multiple components to it. All of them got to succeed if we're going to get to that end point that I've described multiple times from this podium. So I hope that if everyone does their job, we're going to be able to give you a number and say, you know, we've seen that inflection and we're coming down. I would hesitate to do it now, to be honest with you, because it might be misleading, and I don't want to be misleading. I just want to say one other thing, because I heard Dr. Birx say it, and I think we need to say it over and over again. When I was young, a long time ago, I felt that I was invulnerable, the way I think many of us feel we're invulnerable. And when we're asking the young people to help us with this mitigation strategy by staying out of the bars, staying out of the restaurants, really trying to distance yourself, don't get the attitude, well, I'm young, I'm invulnerable. You are, well, in some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating. Please cooperate with us. Thank you.
Dr. Fauci, and I'm going to read my notes so I get this right, but there's apparently a new study out of China. It found that the vast majority of cases, 86%, were in untested patients with mild to no symptoms. So what does that say about the impact of testing, and does it mean that testing should actually go beyond the sickest patients?
You know, that question keeps coming up, and I'm not going to evade the question, but I want to make a point. We tend to think that we're not going to be able to mitigate or contain without testing. They complement each other in some respects, but they're separate channels. Even if we had no testing, we should be doing what we're doing now. The question you're asking, so I won't evade it specifically, would it be important outside of a doctor-patient coming in together, of knowing what's out there, what might be under the radar screen? The answer to your question is yes. So let me tell you what the CDC is doing right now. They're going out there, and part of their program is to get a feel for what is there that wasn't initially thought to be coronavirus, that was thought to be something else. When you do that, you're also going to get a feel of what the penetrance is in society. So we are heading with the high throughput things that you've been hearing about to get an answer to your question.
Dr. Fauci, Governor Cuomo said this morning he believes that we'll see a peak in terms of infection in 45 days. Would you concur with that?
You know, it's possible. I mean, I know that the governor has been really, I believe, doing a really good job of trying to stay ahead of this. 45 days is not unreasonable. You have to be careful. When you get a number, you own the number, and then if the number doesn't come out, you're in trouble. And that's the reason why, from our standpoint, from the federal government, we're talking about a range. So within that range, I mean, it isn't like you want to be correct for the sake of being correct, but you don't want to be wed to something and then have to back off.
Go ahead, please.
When is the soonest that we'll know that these new guidelines are actually bending the curve or actually working? And is there a point in time where you know, in the next couple of weeks, where you'll be able to tell the president more draconian measures are needed?
Well, okay, so what's happening, I mean, if you look as a metaphor, it's kind of like a race against the virus. If left to its own devices, will do this, and us trying to somehow blunt that. Now, you could see the virus going up and up, and your effect, your work, what you're trying to do, may actually be having an effect, but you may not see it because it'll still be going up. And as you're trying to implement your interference with the virus, you may not realize that you're actually interfering, and you'll say, wait a minute, it's still going up. What's going on? You've done nothing. But you don't know whether it would do this versus that. So the answer to your question, it probably would be several weeks and maybe longer before we know whether we're having an effect. It may be at the end of the day, we'll see a curve that would have been way, way up. But I wouldn't put us to task every few days. Well, wait a minute, it's going up. Is it working or not? That would be really misleading if we do that.
Go ahead. Regarding the 15-day guidelines which were announced yesterday, one of those guidelines was a recommendation against gatherings of 10 or more people. And today, the governor of Alabama issued her own guidelines, and it was a recommendation against gatherings of 25 or more people. What is your recommendation for people of Alabama, people across all of the country, as far as the guidelines that were announced yesterday by the federal government?
Okay, so the one thing we don't want to do is to get hung up on the difference between 10 and 25. I think you might agree with that. When we give guidelines, they're only guidelines. We sit down, we look at the data, as Dr. Burke said, we're data-driven, and we say, on different models, 10 looks good. If someone wants to do 25, we're not going to fault them, but if someone wants to come to us and ask us what we think the best is, we stand by the numbers. It isn't perfect, it isn't precise math, it's assumptions and it's data that make you get your decision.
But would it be more effective if every state and every city in the country was playing by the same rules
Yes,
instead of different?
Of course. But this is the United States of America. There's a lot of free enterprise there. People do their own thing. And quite frankly, I don't think there's a big deal difference between 10 and 25. We got many, many more important things to worry about than that difference.
Mr. President, thank you. Going back to supply chains and then talking about preparedness for the future, yesterday Larry Kudlow said that there is an idea floating around the administration to cut taxes for companies who would be bringing their supply chains back to the United States. He said he specifically liked immediate 100% write-offs for structures, equipment, but he said you hadn't endorsed that yet. Would you endorse an idea like that?
We're looking at many ideas. That's one of them, frankly, and we're looking at creating incentives for companies, not only that type of company, but other companies. We're also looking to help companies such as the airline industry within the airline industry, and we'll be doing that. We will be doing that. This is not their fault, and they've been very understanding, actually, and we're going to be helping them. We will have a very powerful airline industry, and it'll start up as soon as this is over. We'll have those planes ready to go. So we have to help them during the short term. We're very important. Yeah, please.
Thank you, Mr. President. I wanted to know, have you taken a look at some of these models, such as the Imperial College London model, that kind of poses a very difficult choice, whether it's shutting down society or overwhelming the healthcare system? Is that something that
we've looked at every model? We've relied on the very talented people, and there's no better team than the people behind me. And I will say that All of the people that have done those models are all in constant touch with Dr. Birx and Tony and everybody that you've been hearing so much from over the last couple of weeks. We've looked at many different models, and the model we have is we want to save a lot of lives. We want to save a lot of lives. If we get too steep on that curve, you're going to lose a lot of lives, perhaps unnecessarily. Now, we're going to find out. Everything has a risk. We're going to see. But if people do what we're telling them to do, what we're asking them to do, you're going to see the saving of a lot of lives. Now, Boris, in UK yesterday, you saw what happened. It looked like they were going a different way, but then he went away of similar, I don't know exactly, but I would say we had a conversation yesterday similar to what we're doing. So a lot of people seem to think this is going to be, we are looking to save the maximum number of lives. Everything else is going to come back. A life is never going to come back, but everything else, our economy is going to come roaring back. You're going to know, we're going to know, we're going to all know that day. If somebody was asking about the day, when will you know? When will you know? We're going to know. All of a sudden, we're going to say, wow, that's looking good, that's looking good, that's looking good, and we're going to be on the other side of the curve, and that's a day that we look forward to.
Is there something, sir, that you saw this week, though, that made you decide that, yes, now is the time to implement these much more stringent social distancing measures?
No, I don't think so. This is where we were going. I really think from the beginning, this is where we were going. This is what we had in mind. We're just going step by step. That was the next step, the next logical step. As Dr. Fauci said, and I think very importantly, one of the most important things when you write the history of this was the fact that we closed it down to China and Europe, but in particular China. We closed it down to China, the source, very, very early, very, very early, far earlier than even the great professionals wanted to do. And I think in the end, that's going to be, that will have saved a tremendous number of lives.
Follow up, one on the economy and the other on the broader picture here, but just to follow up on my colleague, some people did note that your tone seemed more somber yesterday. You talked about that August timeline. Did you see a projection? Some people thought perhaps that 2 million potentially that could die maybe prompted part of that. Was there a shift in tone?
I didn't think, I mean, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
Can I ask one on the economy? Your former economic advisor said almost 100% chance of a recession. Do you see it that way?
It could be. I mean, I don't think in terms of recession. I think in terms of getting it out, because when we're finished with the virus, we will win. We will win. And when that victory takes place, our economy is going to go through the roof. It is so pent up. It is so built up. It is so ready to go in an upward direction. But we have to knock out this enemy. This is a really tough enemy, but we have to knock out all of us. That's all of us. So I don't think in terms of recession, not recession. It's words. We have to knock out this, and we will have an economy. I actually think we'll have an economy like we've never had before. It's all pent up. Did you have something to say, Mike? Yes.
Well, I think the question about the actions that the President's authorized, beginning in January, when he took the unprecedented step of suspending all travel from China, the efforts to issue travel advisories for portions of Italy and South Korea, and then to begin screening all the passengers, the efforts regarding suspending travel from Europe and what went into effect at midnight last night, adding the UK and Ireland to that, have all been informed by the experts that are surrounding us. What the President's asked us to do from the very beginning, as Dr. Birx and Dr. Fauci often say, is let's follow the data, bring the President the best options in response to what is actually happening on the ground. But with regard to yesterday's 15-day slow the spread plan, our team unanimously brought to the President these very strong recommendations for every American, because we truly believe we are at a point in this epidemic in our country when we can reduce the number of people that actually are exposed to or contract the coronavirus. But we'll continue to bring the best data, the best evidence and the best recommendations, frankly, of the best health experts in the world, and the President will continue to make decisions that put the health of America first.
In other words, reduce the number of people that die. That's what we're trying to do. And when you do the steep curve, a lot of people are going to die. A lot of people. You know, the worst ever, they say, 1918. And I don't have to go into the numbers, but they were unbelievable numbers. Had they known and had they done what we had now, it would have been a very much different story. It would still be tragic, but it would have been a very much different. But that was the one that people write about. That was an incredible pandemic, like we haven't seen. But we have done something that I hopefully we will all have made the right moves. We're all in this together, including you, and we want to see fair press. And I tell you what, it's been generally speaking, I think it's been a great thing to see. It's been very, very getting along with Democrats, getting along with Republicans, for the Democrats themselves. There's been a lot of spirit. There's been a lot of things happening that I haven't seen happen in the first almost now 3.5 years. It's been very nice to see. That's one of the good things. But what really the good thing is we have to knock it out. We have to win. And we want to keep that slope as low as possible because that's a lot of lives in there. Let's go back there. Somebody that didn't get one, please. Go ahead.
Mr. President, this has had a huge impact on China's economy as well. Have you received any indication from officials there that they're going to have trouble meeting the purchase agreements, part of the Phase 1 deal, particularly the agricultural buy?
Well, they need our product very badly. And no, I haven't received any. We have good relationship with China. I have not received anything to that. No, we have a signed agreement. They're going to be buying, and they have been buying a lot of product. Yeah, please.
Earlier today, Dr. Birx was talking about the possibility of our hospital system being overburdened, overtaxed, and she talked about certain options that are available to the United States if that happens, including VA hospitals, Department of Defense medical treatment facilities, and even hospital ships. At what point do you tap into those options?
Well, I'll know the point, and by speaking with Governor Cuomo and other governors, we're going to know the point. It's going to be different for New York than it's going to be from, Iowa, or from Idaho, or from West Virginia, frankly, or for it's different. New York has got a big problem. The state of Washington has a big problem. California has some big problems. Everyone's doing a good job, but we're going to know when it will be, and I believe it'll be more spot than it will be. It's not going to be the whole thing. It's going to be spots. There are some hot spots that are in trouble, big trouble, and there are other areas that are in no trouble at all. They watch it on television. They don't know. It's just not affecting them, and they're lucky. They're lucky, but there are areas of the country that don't have much of a problem, and some that don't have any problem. They're not going to have a problem with hospitals, but some areas like New York, California, state of Washington, they're going to have some difficulty. And when we see that coming, we're going to be in there. We're already making preparation for it.